not knowing is actually the biggest concern. And I think for many patients, it drives the anxiety and nervousness that comes with the new diagnosis. It's part of what's really rewarding, right? Because they come in not really knowing what's going to happen. They don't know what kind of side effects they're facing. Importantly, they don't know how the treatment that they need for their new diagnosis of cancer is going to fit in with everything else that's going on in their life. And that's a really scary thing for people. So when you can kind of sit and share all that information with them and kind of tell them what's coming, kind of tell why we're doing the things we're doing, you can genuinely just see people get a lot more relaxed after they kind of learn about what's going on. It doesn't negate all the issues. There's still plenty of things to be nervous about, but it is something that I can visibly see people get more comfortable as we go. So radiation oncology is a really cool specialty. It's really small, so maybe a little less well known. I chose it specifically because it has a really unique mix of patient care, technology, and procedural components. So the way that we're set up, we get to spend a really long time with patients. And then additionally, there's a lot of technology and research. So it's a field where we deliver radiation to patients using new technology, different machines or different kind of procedures. So it has like a really nice mix of the kind of technical and sort of physical component that I like. And then also has really a lot of protected time for face-to-face patient care. I actually did always want to be a physician. So I think what originally made me want to become a doctor was that actually my grandpa was diagnosed with Parkinson's disease when I was pretty young. And he did pretty well with it for a long time. And so it was when he was first diagnosed, I kind of learned about the disease. It was the first time that I kind of dove into like the history of a disease and how it works and what happens. It actually motivated my PhD research, which was in movement science. So it was kind of related to that. And throughout that whole process, I kind of always knew that I wanted to be a doctor. I wasn't sure enough at the end of college to pull the trigger and kind of go to med school. So I ended up doing a PhD first, but working with patients during that totally validated that that's what I wanted to do with my life. What's really unique about Siteman that I have not noticed at other medical centers, and I think why patients should really choose to come here, is that it's a unique mix of the passion that the people that work here have for the center and for St. Louis, and then Siteman's general attitude towards innovation and being supportive of innovative projects. So I think when you combine those two things, it's really a cool thing, because people are very invested in the city and in the cancer center and helping the citizens of the city the surrounding area when they're diagnosed with cancer. And then we're doing it in really innovative ways, and not every big institution is really supportive of kind of new ideas or things that might be a little different. Siteman totally has been in my experience so far, and that's something that I just love about this place. I split my time. Half of the week I basically spent here at Siteman at the Center for Advanced Medicine at Barnes-Jewish Hospital. And then actually the other half of my time I spend at our new Siteman Cancer Center in North County at Christian Hospital Northwest Healthcare. When I treat people there, I offer them many or almost all of the same clinical trials that are available to patients at the main center. We also have one of the most modern radiotherapy machines at that center that's able to do almost all the specialized treatments that we can offer at the main center for the patients there. And what's really cool about it is North County is a place that, in my opinion, really needs that. I think that it's really a privilege to be able to offer the best cancer care in the country to patients really close to their homes in North County, and they really love that. One of the most rewarding things of working with patients is when you get to the end of all the treatment, you get to continue to follow up with them and kind of see how patients grow and really thrive after they finish treatment. So as an example, sometimes we'll get to the end of therapy and I'll check in with patients much after they're finished, a year or two, and they might share with me that they've sort of reorganized their life. They might have changed their priorities or even taken on new efforts. The best is when they take on new efforts to become patient advocates. So not only were you able to kind of help them better understand what's going on with their disease, conquer what they've been fighting with their cancer, and then thrive after therapy, but they're then now turning around and you've helped generate someone that's going to go and help other patients into the future. So it feels really rewarding to be able to have that happen after a patient finishes therapy and moves on with their life.